There are a lot of myths about cholesterol medicines and taking cholesterol medicines. The most common way to treat cholesterol is statins because they're one of the only medications that reduce cardiovascular risk, so reduce the risk of heart attack and stroke for people who take them. One of the biggest myths about statins is that they're overprescribed by doctors and that they do very little to reduce cardiovascular risk, meaning that a lot of people are prescribed them, but their potential to reduce heart attacks and strokes and improve life is very low. We have treatments that we know really work, and those treatments like statins are very easy to take with very few side effects, very little cost, and have, tremendous impact in reducing heart attack, stroke, and having people live longer. The most, difficult myth to explain to people is the myth that cholesterol-lowering medicines, particularly statins, are only useful to reduce your cholesterol number, when in truth, we are really using these medications to treat cardiovascular risk. Sometimes that's independent of what somebody's particular cholesterol number may be. It's very important to have dialogue with your healthcare provider because there are a lot of misunderstandings that are out in the lay press, sometimes on televisions or magazines or newspapers. They're presenting things that may not apply to you. For example, there was a big article that came out in a newspaper telling people not to use aspirin. It turned out what they were talking about were people who had never had a heart attack or stroke who were older. So a lot of people ended up stopping aspirin who really should have been on it. It's the same thing with statins. There's not a one-size-fits-all for reducing cholesterol and treating cardiovascular risk. One person could be a diabetic, and their goal for their cholesterol could be very different than somebody who has fewer risk factors and a different cholesterol profile. So only your healthcare provider would know your personal risk factors and your personal data to make the right decision.